Welcome everybody. It's great to see you all here. I'm Randy Wyckoff. I'm the Dean of the College of Public Health, and I'm pleased to welcome all of you and everyone online to the first Leading Voices in Public Health lecture for the new academic year. For those of you who don't know, Leading Voices started in 2007. Since then we've had over 100 speakers, ranging from politicians to book authors to performing artists to researchers. And the whole idea behind the series was to bring in folks who could help us think a little bit differently about some of the health challenges we face in Appalachia. Now, you may wonder why someone talking about uranium mining in the Navajo Nation is relevant to what we do in Appalachia. But if I told you there was a talk tonight about an extraction industry that caused direct health consequences to the miners, that impacted the communities around them, and despite millions of dollars coming out of the ground, those communities were impoverished with lack of educational opportunities, lack of jobs, you'd say that sounds an awful lot like Appalachia. The only difference is here it's coal and there it's uranium. So I'm really excited to have our speaker with us tonight. And to introduce him, I'm going to ask Dr. Rod Handy, our chair of the Department of Environmental and Occupational Health and Safety Sciences, to introduce our speaker.
Hello, everyone. I've got the pleasure tonight to introduce to you Dr. Tommy Rock. Tommy Rock is currently an assistant professor at Northern Arizona University, which is also his alma mater, where he got his degree in earth science and environmental sustainability. I had just a great pleasure of becoming acquainted to him in 2018. I want to make sure it wasn't 19, 2018, that I had Dr. Johnny Lewis of the University of New Mexico, who was on his committee, reached out and said, we got a guy that wants to do a postdoc. And fortunately, we had just at that time got a CDC grant that supported doctoral students. So fortunate for us, he said yes, and he was able to work with us on a lot of different, tribal. We worked with, of course, the Navajo. We worked with the Northern Arapaho, still working with them. The Goshu, the Utes, the Mountain Utes. I mean, he showed where they lived and stuff on our trips. And today, he did a talk, and the students in the classroom, I said, well, Tommy was talking away and everything, and I said, yeah, from Forrest Gump, the Four Corners, we're Forrest Gump, and no one had seen Forrest Gump in the classroom, so they didn't, where he stops, where he's running and says, I'm done, right? So it's something that I think we keep finding, and that's where Tommy's from. So with that said, I think I'll just welcome you to. I think you use that mic.
Yep. Hello? There you go. If I kind of teeter off, just go like this or go like that so I can raise my voice. I tend to slowly fade sometimes. Let me introduce myself in Navajo. It's a formal way of introducing myself. I sent some web address to this place so they can see this live feed. So yeah, that tells you Tommy Rotten Shadow. She don't no that she slanted some she 20 that she don't look at me that she not had and then she don't. Basically, they I like such a team. I don't can stand the other shout that I didn't. Hi, my name is Dr. Tommy Rock, and what I just said is I said my clients. I have 4 clients. This maternal clan, and I said my clans are the Ute Salt clan, that's my mother's clan, my father's clan are the Mini Goats clan, and my paternal grandfather are the Bitterwater clan, and my paternal grandfather are the Bitterroot clan. Those are my 4 clans. And I said, I came out of Copper Canyon. That's where my grandparents reside from. That's where we have our livestock from. And I said, I am a professor at Flagstaff at Northern Arizona University. That's what I said. And that's a formal way of introducing myself to my audience and to the indigenous people that are viewing in. And also, when I introduced myself, I said, Kahasni. That's one way of saying hi greeting. And another way of saying that is Kwasan, 2 different ways. And the reason why there's 2 different ways, like in Navajo, there's we have our ancestors around. So when I say Kwasan, I'm referring to people that are here and the people, our ancestors that are present. So that's what I mean. So for the living and the dead, that's what I mean. That's who I'm greeting as well when I say Kwasan. And when I say Ta'asnikla, I'm just referring to the people that are here present right now and the people that are viewing. So that's the difference. And thank you for coming, and thank you for inviting me here. And that is a picture of near my home. I'm making sure that. Oh, there you go. That's Train Rock. It's a rainbow. That's a hogan, a traditional Navajo hogan. That's a female hogan that represents when his mother's pregnant. And there's, I believe, 9 logs, I believe, and then 12 posts all the way around, and 8 that goes up. And that represents when his mother's stomach, the month of the year when the mother's pregnant. And so at night we go back in, and it always faces east. It's like we rise when the sun comes up, or before the sun comes up. And one of the teaching for us is like when we wake up, we go up before the sunrise and we say our prayers. And when we pray, and this is what my grandfather was teaching me, is like each of us have a feather in the back of our head. We don't see it, but it's there. So the first thing that the sun touches is the feather, and it answers our prayers, and the answers are up. And that's what I was taught. So that's just why the hogan is facing east, and to rise when the sun goes up, and to go to run as well. And the past 2 years, I was a postdoc at Princeton. So this are some of the institutions. Like I was in the geo department, collaborating with the engineering department, doing air quality work, and got funded by High Meadows Environmental Institute. And Talani Lake Enterprise is an organization, a native-led nonprofit organization that I worked with before, and I did numerous work with them. And the reason why I do what I do has to do with this guy. He's my grandfather. He was a World War II vet, and he was also a former uranium miner as well. And he passed from cancer. So that's the reason why I do what I do. Try to help my family members, community members, and my tribe, and other tribal nations that are facing the same thing. And that is my grandmother. She passed away at 106. And it's like I have a lot of fun with her, playing around with her. And I went up to visit her. Yeah. And my doggy, Mac, traveled the country twice. And fortunately he passed, so Miss McDoggy. And historical contents, and I want to talk a little about this, which relates to this issue of public health as well as like the manifest destiny, doctrine of discovery, and the Dawes Act, the Indian Reorganization Act, the Indian Religious Freedom Act, and the boarding school. And each of these policies have a tremendous impact on the indigenous populations of assimilation, forced assimilation, colonization, and many tribes that were lost around that time as well. And currently there are 574 federally recognized tribes within the United States. There are 63 state recognized tribes. The preliminary power retained by U.S. Congress, and the Indian Citizenship Act was January 2nd, 24, and the last state to recognize this was the state of Utah back in 1957. And with the Indian Religious Freedom Act, even though Religious Freedom Act, or one of the stuff that's written in the U.S. Constitutions, the reason why we have this is because as indigenous persons, we don't have that freedom. Anytime we practice our culture, our tradition, our ceremonies, cops are always at our doorstep and telling us we're practicing witchcraft or we're worshiping the devil, so on and so forth. One of the incidents, my friend Daisy, she's Eastern Cherokee, that she went to an event in Detroit. When they were doing their ceremony, the cops came and broke that ceremony up. And even though Indian Religious Freedom Act, we have that, but it has no teeth. And also when it comes to our sacred sites, where we go to pay homage to our ancestors and practice our tradition and culture and so on and so forth, a lot of those places are desecrated and we can't go there. And when we talk about those sacred sites, we keep it a secret for a reason, because it's exploited. You see, I don't know if anybody have been to the Southwest before or been to the West before, but you see a lot of the Kachina dolls or Kachina figures. We don't want any of our ceremony to be exploited like that and be profited off of. And I'm pretty sure you've heard of an incident in Sedona, Arizona, where, if you haven't heard about it, you'll hear about it now. It's an incident that happened in Sedona, Arizona, where a person was practicing a sweat lodge and using some native chants. And he was having people that are non-indigenous coming over, paying a lot of money to have these enlightenment, so to speak. And one or two people passed away and he was sent to prison. And when indigenous folks found out what he was doing, they told him not to do that. That's not the purpose of that. It's not meant to be profit off of, and is to be respected. So even though we have that, we still have issues with that. And for Navajo Nation, every tribe is different. And for my tribe, it covers Utah, a little piece of Utah is like on the top area. That's the Utah Navajos. Then there's some in Arizona and New Mexico. And it's broken down even more into like Western Shiprock Agency or Northern Agency, Eastern Agency, Fort Defiance, and Chinle Agency. And this little polygon is the Hopi Reservation. We surround the Hopi Reservation. And these smaller polygons are chapters, they're like counties. And every month they have planning meeting and meetings, like town hall meetings. And so we discuss issues that are facing our chapter, our region, and the stuff that are facing our tribal nation as well as a whole. And to do research, well, there's 110 chapters, and to do research, we get community support we get chapter resolution, we get agency support, and if it's environmental health study, we contact Navajo Nation Environmental Protection Agency, so they understand what they're doing, so we share data with them as well, so they're aware of data that will be coming in. And we go to the Navajo Nation IRB board, and once we go through the Navajo IRB board, then we go to the academic institution where we're at and go through that IRB board. So all this process may take from anywhere from 6 months to a year to do, and depending on how many chapters that we're working with, because each chapter have their meeting on different days during the weekend, so we can't make all of them, so we gradually get all the support letter that we need, or community support letter that's needed. And it covered 27,000 square miles, and we are one of the largest, second largest indigenous population in the U.S. And Cherokee is number 1. And in this slide, I would like to show you where the uranium ore is coming from. It's between the Moenkopi and the Shrimp formations, right in between there, and that's the ore. The ore is coming from late Triassic period, and there's like a river that flew from Texas to Washington, and this big river had tributaries. So each of those tributaries, where the ancient water were flowing, the streams, the rivers, you see a lot of the ores there. So you see a lot of them in there. That's where the ore is coming from. This is Skyline. I put this up because there's people down below, and I did a study seeing if any of the dust from the top is going down below. I put one near the wall, one further away from the wall, and one where the people live. And I do see some of the uranium dust coming down that area. And I wanted to put that slide in this presentation, but the GIS software that was working went kaput. So I tried my best to put that slide in there, but unfortunately wasn't able to do that. And another reason why I want to put this in there is because there's a documentary called Return of Navajo Boy, and it talks about the family that live in that area. And they built a home that was made out of the abandoned mine waste. The foundation was made out of that. And the family that lived inside that octagon, a lot of the kids were in direct contact. They were literally sleeping on that. And a lot of the kids passed away from cancer due to that. There's a few surviving members, and that documentary talks about the impact that it had on the family. And there's a person by the name of Judy Pasternak that did a story on that, and she ran that story in LA Times. And there was a congressman by the name of Henry Waxman from California that saw this story, and she got the five federal agencies together: U.S. EPA, Department of Energy, Nuclear Regulatory Commission, the Indian Health Service, and CDC, and told them to clean that mess up. And they started coming together and talking about remediation, cleaning up all these abandoned environments. That was the discussion started back in 2006. And the funny thing that I witnessed at the time, I was a master's student, and I went to one of the meetings, and in that meeting, my tribe and the Hopi tribe, they hired scientists. And at the meetings, they had U.S. EPA on one side, they had the Hopi and Navajo on another side. And each time one of the scientists would mess up even the measurement. When they're talking about water, for example, they say microgram per gram. And one of the scientists would jump up and say, "You're doing that wrong, it's wrong." It's like microgram per liter. It's like they would go back and forth. And I found that amusing because here is this person from US EPA, a regulatory agency, sitting there, and these two scientists are having disagreement on measurement. And we're talking about exposure, uranium exposure to the public. And here are these two people arguing about measurement and anyway. So where I'm from, we saw where the uranium ore is coming from the Grants Mineral Belt. That area, the ore is coming from the wastewater formation. It's part of the Morrison Formation, coming from there. And that is a map of the Grants Mineral Belt, and all the red dots are where all the abandoned uranium mines are located. And the reason why I put this up, Sanders community up, is I did a lot of my work in that area when I was doing my PhD, and which I will explain that a little bit more later in the slide. And this is another community where I did a lot of my sampling. And this is the petrified forest formation, or sandstones, upper Chinle formation as well. And all these little dots that you see here, these are all the abandoned uranium mines, and most of the population live in that area and along that area. And people are still living there. And the community want to put a farming in that location, and we work with them on trying to accomplish that. And we're still working with them as well. And other institutions like University of New Mexico is getting involved with that as well, and talking about fighting remediation as well. And this slide talks about the mine spill that happened in 1979. And these are some of the accidents that's related to nuclear industry. I believe Chernobyl's on top, and at the very bottom is Church Rock. And 3 Mile Island is the second. That's 3 Mile Island accident. And if you looked at the radiation that was released, so right here is like 270 million picocuries, and 3 Mile Island is 13 curies, and then Church Rock spill is 46 curies. So it's a little bit more than 3 Mile Island, but since this is on Navajo Nation, there's no publicity back in 1979, so nobody knew about it. And still a lot of people don't know about it. And some of the stuff that was released, there's the uranium, selenium, there's gross alpha as well, there's radium as well, thorium as well. And it's like over 200 times. It's like very, very radioactive. And I've heard stories from the people that were present when this accident happened. They're talking about walking in the water, having their at the bottom of the calf or bottom of their feet burning, or their legs being burned, because that was literally battery acid flowing down the river. And after the incident happened, or the accident happened, some of the sheep were deformed. Some of them were born without fur. So there's a lot of deformation that happened with the livestock. And cancer cases as well. And one person was talking about their relative having cancer at the bottom of their foot, skin cancer at the bottom of their foot. And with indigenous populations, health disparities, it's like we are still facing this issue of water quality, water availability, and also exposure from uranium and prenatal health. This study is being done by University of New Mexico, and they're seeing that when a person lives near an area that have past uranium mining, like the mother, that exposure is being passed on to the baby, and the baby is still inside the mother's stomach. And when the baby is born, they'll get a sample of the placenta, and they'll get a sample of the baby's urine, and you'll see uranium there. When I was doing my PhD work, we would picture a sheep with a lamb inside, and we'll see uranium in the the baby lamb's kidney and liver and stomach. So there's definitely becoming more generational. This exposure becoming more generational. This chronic exposure is becoming more generational. And some of the stuff that I look into is the pathway exposure, like air, soil, water, food, livestock as well, plants, and how it affects us. And this is the work that I did in Sanders, and these are the people that I work with, Jacques Cerrone, Chris Shuey. I sent a link to Jacques Cerrone to zoom in on this presentation as well. And he's a great friend, and I like working with him, and I like working with Chris Shuey as well, and Janine Yazzie. And for this is like the incident happened here, Church Rock, and this location, there's no uranium mining in that area, but the question is like, where is the groundwater, where is that coming from? So most of us, the people that work on this project, think it's the groundwater contamination is coming from here, from the over 20 years of mining and milling. They were dewatering the mine, so the water be flowing all the time because the water table is high and the ore is below the water table, so to dewater that and get to the ore. So the water is flowing year round, and the spill that happened from 1979. And this map shows you the abandoned uranium mines in Navajo Nation. These triangles are all the abandoned uranium mines, and the circles are water contaminated, unregulated wells that people are using. And the color means that the darker it is, there's more pathway exposure, like getting the materials from these abandoned mines, abandoned mills, to building homes, foundation, horse corral, sheep corral. And on top of that, they have exposure to the abandoned mines and contaminated wells as well. And the white polygons, like no exposure in that area. And again, it's like there's the Sanders area, Sanders location. And this project, we got funding from EPA, Environmental Justice Grant. And I wrote the quality assurance plan, basically telling the community members that will be involved how to do sampling. And it got signed off by US EPA Region 9 Quality Assurance Office and my tribe as well. Again, the reason why we did the study, and also water security, because we don't have that much water in the Southwest, and this is like Nahata means planning in Navajo, so the idea is like to plan for the future and to try to fight the state of Arizona about our water rights, because we have a limited amount of water and want to utilize all that water and maintain that on our reservation so people can have access to water, and also about community empowerment as well. Again, the regulated water, they look like that, people being lined, and unregulated water source, meaning that they're not sampled on a yearly, monthly, quarterly basis on heavy metals, radionuclides. They're not sampled for waterborne bacteria. And during the summer, some of the water infrastructure in Navajo Nation gets so stressed that they turn off these regulated watering points. So the community members have no choice but to go back to these unregulated water sources. So it's still an issue. And when COVID was happening, this became like a big spotlight. So I put a big light on the issue of regulated watering or access to water or potable water on Navajo Nation. And there are many people that try to address that, and they basically tap into the water lines and make water access, and it's still an issue, and it's still ongoing as well. So some of the stuff that I'm thinking about is related to that as well, which I'll talk about later in the presentation. When we did this project, we did citizen science. We did 2-day training, and I invited Navajo Nation EPA to come over to witness it. I collaborated with Chris Shuey from Southwest Research Information Center out of Albuquerque, New Mexico. He has over 20 years of experience doing research related to uranium exposure or environmental exposure, so he has a lot of experience. And we talk about teaching the community members like basic cartography, mapping, GPS, GIS, water qualities, radiant clouds, and was open to the community members. We provided breakfast and lunch, and we hired a caterer to make lunch for everybody that attended. And this is a regulated water point. This water source is still being used. It's about 10 feet deep, and when I was there, I'm pretty sure there's waterborne bacteria because I've seen a lot of livestock in the area, and I'm really concerned about nitrate as well because, again, it's really shallow. And then on the second day, we went out and collected water samples. I was on hand, so when the community members were taking samples, and if they have questions, and I would go answer the questions. And I showed them how to fill up the paper to sample or to ship off the water sample as well. Transfer of custody or custody, chain of custody, showed them how to fill that out and send that to the lab as well. And this map shows you, we sampled like 186 wells, springs, and we sampled south of this is the Perkle River. We sampled south and north of there as well. And since I was working with US EPA, they told us to go out there and get some water samples because that community is called Blue Gap Touchy Chapter. And I went out there myself and got the water samples. And one of the highest readings that I got was from that community. And that's like 220 parts per billion to 430 parts per billion. It's like and that's an area called Mine Claim 28. There's a spring there that people used to use, and I'm telling people not to use that water no more. And that is Cameron. And out of 186 samples that we did, about 11 to 13% showed elevated level of uranium. And anytime we get a hit and it's elevated above the standard, we'll go back and get another sample. And the first sample that we did was this lot 18. And we sampled, the community member asked us to sample the school as well, so I went over there and got a water sample, and it shows that it was above the NCL. And that's the administration building that I went to and got the water sample. And if you're familiar with the Safe Drinking Water Act, anytime there's exceedance in the public water, they're supposed to issue a notice and tell you the community member not to use that water. But for this community, they never did that. The Sanders community, they never got that notice. And the school was not notified as well. And they were actually put off the list as a public water source. So Arizona, the Department of Environmental Quality, a person from there put them as not as a public water supply or public water anymore. So when we did this project, and we're done with that, and we got news cover from NBC News, and once NBC News covered that, then it's like everything changed. We were fighting with US EPA, we were fighting with Arizona Department of Environmental Quality. We had numerous conference calls, and the conference calls were really heated. It's like a little shouting match that went on. And one of the concerns that EPA was making was it wasn't chronic. So my colleague, Chris Shui, used the World Health Organization, the chronic exposure definition, and put it in there and showed them that it is chronic exposure. And again, this shows you with the amount of sampling that we have about 9% or 17% or 10% of that water sampling will be exceeding the UN MCL standards under the Safe Drinking Water Act. And with our sample, we're the same way as well. And here's ours, like 10%. This is actually not 102, it's supposed to be like 186, I believe, and it's like 11 to 13%, I think it was. And I'm gonna go a little fast right now because of the time, due to time. This is Sanders, the Perker River, and the water, where the water contamination is at. So a lot of stuff that I use, the software, the Esri product, ArcMap, JS Pro, it helps illustrate where the problem is. So I like using GIS for a lot of my research. And this is the public water. There were some folks that did research in '88. So from '88 to 2003, we didn't know when the uranium level went up. So that just shows you that. This was done by Chris Shui. And the school as well. It shows you graduates going up. And this is the notice from Arizona Department of Public Health. They went to the community. They were telling them that to keep using the water, it's fine, it's okay. But the community members disagreed. There were 2 of them that arrived, and by the time they left, they were just bawling, crying. They went back down to Phoenix. And I think that's the thing that a lot of the people from the state or federal agency, they get disconnected when it comes to environmental exposure. Even though you have hard scientific data, they tend to brush that aside like this, and they're telling community members it's okay. I disagree with that. I see a lot of that in a lot of the work that I do. And some of the stuff that I'm still doing the lead isotope research and getting some help from Princeton University. My friend Steph, she's helping me rerun a lot of the lead isotope in John Higgins' lab in the geoscience department, and working on doing a environmental health study for that area as well. The community members have been asking for environmental health studies, so I'm working on a proposal to do that. And this is making that transition from uranium exposure to oil and gas. And this is a exploratory well looking for oil, and the community members still using that. And I've seen a little oil on top of the water, and people are using that for farming and for livestock as well. And I've seen 3 or 4 of these being used, and the water is coming out, and again, you can see some of the oil on top of that real shiny stuff. And this is in Aneth, and a lot of the oil and gas field are coming from the Paradox Basin, the San Juan Basin as well. And this is the Paradox Basin, and that is the San Juan Basin. So a lot of the work that I'll be involved with are in those 2 locations, working with community there and talking about air quality and how that impacts our health. And this is a study that I was involved with from Princeton. And some of the number from here is like, the highest is like 200 or 2,400 parts per billion. And on this side is benzene, and that goes up to 1.4 parts per billion. And I want you to remember this and the numbers there. The reason why is this is a reference exposure level for benzene. And some of the stuff that I was showing you, it's like exceeding that. And a lot of the kids are being exposed to that. And from the Anna side, there's an elementary school, a high school, and a clinic near there and being exposed to that. And some of them, sometimes during the winter, it exceeds that. It goes up even more. And that's just one gas. There's benzene as well. And the one I'm really interested in is hydrogen sulfide, so I wonder what the numbers are for that. And I put this as a reference, show you, like, for example, OSHA standards, that NOsh standard as well, and where their standards at. This one. And what it's just showing you is like a little bit of one. And these are the community members that are being exposed, and that chronic exposure, they live in that type of environment year round. And during the winter season, when it's cold, you see all the gases go down, so you see that inversion. And I took a picture of that, but I can't find that picture of the inversion that I took. And the Safe Drinking Water Act, the limitation, alternative, and ways to preserve Navajo culture as well. And this is one of the projects I work on and got some funding from Wine to Water and improve these spring catchment system with Princeton and put in much thicker pipes. And it's working. When I was working on this project, I had some of the tribal folks that work, this is inside the tribal park, they're not allowed to have running water or electricity. So the tribal park folks were telling me this is not gonna work, but I proved them wrong, and I love doing that. And this was done by the Sixth World Solution, putting in water catchment system. And this is one of the projects I work on. I replaced this big tank and put in a plastic 2,500 gallon tank in there, and it's full, and people are using that, and I'm very happy about. And this is along the Lower Colorado River, working with the Wine Lake Enterprise. My main project for this one was looking at water quality, getting the water sample, and making sure that the water quality was safe, so people in that area can use that. And how does uranium get in the water, in your bodies? Through inhalation, dust. And the most likely way of uranium getting inside your body is water. It's like drinking contaminated water. Sometimes plant, but most common is through water. And exposure, poisoning, occupational exposure, bystander exposure is like, this is mostly where we are. A lot of my work is chronic exposure. And from a Western point of view, like doing the risk assessment, working in indigenous populations, a very Western worldview of looking at risk assessment versus traditional view when it comes to risk assessment, household, seasonal variation, house, community coming together, is like everything coming back to family. And this circle is like, this is more linear. This is more a circle. And for indigenous worldview, that's a lot of stuff that we do is in a circle. And this is another way of looking at it. Risk assessment. This was made by Jamie Denentutu, working with the Swinomish tribe up in the state of Washington. It's called Indigenous Health Indicator. It's very similar to health impact assessment. And the Sanders outcomes, like Sanders, they have a Sanders Homeowner Association. The school got a water filtration system. My tribe took over the regulatory responsibility as well. And again, I'm still doing research, looking at groundwater contamination and where it's coming from. And this is the type of work that I'm doing. What I'm very interested in doing fighting remediations, looking at water quality from uranium mining as well as oil and gas field, looking at air quality in the oil and gas field area as well, and looking at livestock and how that impacts our environment, and working with traditional knowledge holders, which is shaman or medicine man and medicine woman. And acknowledgements. Sorry, I went pretty fast towards the end because I was just looking at the time. It's like 6:48, so I want to have time to have you all ask questions.
And two questions. The first is, who owns the land and the mineral rights on Navajo Nation? And if, as I suspect, it's the federal government, what keeps them from suing them? The second question is, does anybody test the rainwater to see if the contamination actually from evaporation makes it up into the clouds and back down?
I think you just answered the first question yourself. It is the federal government. And the mineral rights, some of it belongs to the tribe, but some of it belongs to some of the mining company in the area. And my tribe is, for example, over in Church Rock, New Mexico, there's a company that came from Canada, and part of the reservations are checkerboard, meaning that some of those checkerboards are owned by individual family. It can be Navajo or non-Navajo that own that little piece of land. And if it's non-Navajo or Navajo, they can go sell the lease to a mining company, which happened over in Church Rock. So this company from Canada came in and started drilling for uranium ore. But they are stuck there. Even if they mine it, they're surrounded by Navajo Nation, and Navajo Nation controls the road, Navajo Nation roads. So they are forbidden to transport any uranium ore within Navajo Nation and within Navajo Nation land. The stuff that's going on over in the south rim of the Grand Canyon, the highway is a state highway, federal highway as well. So even though it goes through Navajo Nation, the Navajo Nation can't stop it. So that's the big difference between what's happening in Church Rock versus what's happening over on the south rim.
So you had some missing data in the Hopi Nation. Is that the area that you were talking about earlier where there were some safety concerns with your crew over trying to collect the data? If you go back a few more,
That one? No, this is like entirely different. If I want to do some research or collect any data, I have to go and get permission from Hopi because I don't want to create conflict. So I have no data within the Hopi reservation because of that.
but it is planned?
Excuse me?
Is it planned?
I am talking with a person from Second Mesa on Hopi, and we're talking about doing some work around water quality. And for Hopi Nation, their water source is elevated in arsenic just naturally, just because of the geology. So they have an issue with arsenic, and they've been fined by USCP before. This is like public water, and for Navajos that live near there, like in that area, there's a place called Jedito, and they don't have public water or a regular watering point where people can get water. So they go to Hopi to get water, and that water that they're getting is elevated in arsenic. Even though if they get there, it's like there's still an issue, and it's related to this talk about public health.
Hi, thank you for your presentation. I wanted to ask you, did you encounter any challenges, or what was your experience like when you were engaging the community to work with you in the projects?
From the community side, I have no problem, and as a matter of fact, when I was doing some of the environmental justice work with Talana the Kingdom Prize, when I was working with the community members, I told them that call me anytime, and one person or two people took advantage of that, and they called me, one person called me at 10, and another person called me at 11. I didn't mind that, because what I like is questions, and the person that called me at 11, we had a 2-hour conversation about water quality, and for me, I enjoy that. I really enjoy that, and the person benefit from that as well. So it's like the people that I work with the community members that I work with, I usually give them my contact information, my cell number, or my email, so they can contact me and ask questions. So for the community work with the community members that I work with, I encourage them to ask questions.
Thank you.
But some of the difficulties that I've had with was from US EPA, not with the community, but with the federal government.
Thank you. So the mining is ongoing, is what I'm understanding, and that are there new rules about the polluting, so that they have new regulations about allowing the pollution, and that the cleanup is not from the old mining, or is all ongoing polluting and that's not resolved yet?
There's no new uranium mine on Navajo Nation. We have a moratorium on that. So nothing's happened on Navajo Nation, but off the reservation, yeah, there's new mining that's happening, like on the South Rim. So that mining is happening. And anytime the conversation about new mining comes up, there are a couple of grassroots organizations that will come together and put a stop to that. One of them is the Whitewater Pond Road, which is over in New Mexico. Then there's INDOM as well, with Eastern Navajo against uranium mining. And there's also Dene Care. They're like watchdogs, like constantly being aware of where natural resource extraction is happening. So one of the new topics that's hitting my reservation has to do with a hydrogen pipeline being piped across Navajo Nation. And last year, around December or January, there was an incident that happened, or an accident that happened over at a place called Shiprock. And the accident has to do with a grader cutting open a pipeline where crude oil was spilled everywhere, and the gases from that went everywhere. Some of the people were sent to the hospital because of some of the gas that were exposed to them as well. And the person that was grading was not aware that there was a oil pipeline just right there, and it was really close to the surface. It should have been way deeper than that, way deeper, but it wasn't. So due to that, there's quite a bit of grassroots organizations that are constantly being made aware or being aware of what's going on my tribal land, so something like that won't happen or come as a surprise. But in terms of uranium mining, in the state of Utah, not far from where I live, on Bears Ears National Monument, a place called Fry Canyon, away from the public, there is uranium mining that's happening. And the uranium mill is not too far from there as well. And I've seen mining claims in that area because the price of uranium is going back up. So I know for the state of Arizona, the state of Utah, they're moving forward with uranium mining and milling as well. And the funny thing about the state of Utah is that they're the one that rejected Radiation Exposure Compensation Act. That's for the miners and millers. So we'll see what happens.
David Wood, pediatrician. Thank you so much for your talk. And I was wondering, I know that there's been birth defects registries in the Navajo Nation, and wondering if any of the work you've done is, if you're relating that to any of the birth registries or fertility rates or miscarriage rates or anything affecting fertility, birth, and birth defects.
That I can ask the researchers from Europe and Mexico. The stuff that I talk about, the birth cord study, the prenatal stuff, that's coming from the University of New Mexico. The research team from there. I can ask them about that, so they would know.
Any follow-up questions? Yeah.
My question is actually for both Dr. Wyckoff and Dr. Rock. Dr. Wyckoff, when looking at the effects of uranium mining in the Navajo Reservation, do you see some of that reflected in West Virginia and Kentucky with the coal mining, and do you see similar patterns?
Well, the product is very different. Many of the outcomes are the same. And the fundamental outcome is you've got an area, whether it's Navajo Nation or Central Appalachia, where a tremendous amount of money has been taken out of the ground. And yet these areas are some of the poorest, at least healthy, at least well supported in the country. So yeah, there are similarities. There are obviously differences in the kind of toxicity associated with uranium than coal, but I do see a lot of similarities.
Yeah, I agree. And when I was talking about doing this presentation, I was just mostly talking about uranium. But with uranium ore, that's just one piece of it. It's actually a mixed exposure that's happening, because when you look at the uranium decay change, it's like from uranium all the way down to lead, and everything in between, people are being exposed to that. It's not just uranium. And some of the stuff that I worked on in Bears Ears National Monument, I seen elevated level of radium, I seen thorium as well as vanadium, and I seen signs that says like use off-road vehicles like Ford Tracks, mountain biking, dirt bike as well. So all that dust will go up. And there's a place over in Fry Canyon. There's a former uranium mine called Happy Jack. It's on top of a hill, right on top of a ledge. And I seen washes, like 2 washes that come from there. And when I took some sample of that, I seen thorium that was elevated, uranium was elevated, vanadium and thorium as well. And I went to another location that had nothing of that. And all the numbers, there was like no detection in those areas. So the people or the public that go to those areas, they're being exposed, they're breathing all those in. And the stuff that I put on here, especially when it comes to the dust, is like, if we look at air quality, it's like, I think the smallest it goes is like 2.5 micro. And those dust, some of those are so fine and smaller than that. And the smaller they are, the finer they are, it'll go deeper in your lungs, and that's an issue. And there's some studies that was done by the University of New Mexico at a place called Blue Gap Plateau chapter as well, and another one that was done by Navajo Technical University as well. They found the same thing as well.
Do you think, like, you talked about the community education, like educating the Navajo community about water testing and stuff. Do you think if we did something similar to that with just community education in general about the effects of coal mining in West Virginia and Kentucky, that would have some benefit?
Yes, doing community outreach, and one of the things that always comes is like having a centralized data, it's like a data set that people or the community can go to get that type of information so they become aware. And yeah, it's like the other thing that I can think of is like for a student project, doing some sort of like a documentary film on that. And I say that because that will create empathy as well, and people will become aware of that as well. And I think it's such a powerful story. You don't have to be a scientist to do something like that, but I like using media like that. So it educates just the general public as well, so they become more aware of it, and again, creates that empathy as well.
Dr. Rock, I just came today from the Central Appalachian Coal Summit, and one of the presentations was on fugitive dust, fugitive coal dust, getting into the community, the production. And I wondered about, is there uranium dust? I missed the early part of your session, I'm sorry, but do you have those issues as well?
Yes.
With production and ambient air, they're measuring ambient air in different sections of Central Appalachia. So, thank you.
Oh yeah, it's like this area, that area is Black Mesa, and on top of Black Mesa is where we used to get our coal. It's like a Peabody Coal Company, had a company up and going there, and they seen uranium in the coal.
Perhaps one more question.
Dr. Rock, is your group focusing very much on environmental remediation? If so, are there any strategies that you're currently using or planning to carry out?
Actually, yeah, it's like I am very interested in fighting remediations, and I am interested in doing hemp because I am curious I'm very curious about if that can improve water quality, and I was wondering if that can improve soil as well, get all the heavy metal like uranium out of the soil and get rid of that as well. Then the issue will be like what to do with hemp, and I do know some folks from Navajo EPAs like I'm trying to dispose of it, working with them. So that's one of the things that came to mind. The other one is like I'm looking for ways to address water contamination from uranium, because it's like for my tribe, and that comes up a lot. And as a matter of fact, I do have companies coming up to me, emailing me or calling me about their water filtration system. And the issue with that is, if it's a water filtration system that the community can use, for uranium will accumulate. And the more it accumulates, then it becomes more radioactive and becomes even more dangerous to handle. And I don't want the community members handling that, because they're being more exposed. So the issue is like, how do we come up with a safer way to address water filtration system? And that's something that I've been thinking about, and some of the collaboration that I'm working with at the moment is like we're discussing that ways to do that. So yeah, working on it.
How about another round of applause? Knowing that he flew in, we always have gifts that are slightly too large for carry-on luggage. We'll have to mail it to you. Thank you very much.
Thank you.
And thank you all for being here tonight. Our next Leading Voices speaker will probably be in the spring, but it's going to be an interesting one on the impact of the American Civil War on modern healthcare and public health. So we'll send out a note. And for those of you who didn't get the email, if you didn't get an email about this event tonight, let me know, and I'll make sure that we have you. I think what I did is I missed one of the listservs. But anyway, and Dr. Rock, are you willing to talk to some folks privately if folks want to come up to you?
Oh, yeah.
You have no choice, really, but I'm glad I Thank you very much.
Again, like I said, I like questions, so if I have questions, and I'm here.